Awesome. Okay, hi everybody. I'm Anna Swigart. I'm Director of Data Engineering at Helix. And so today I'm going to talk about how we're approaching building a scalable data foundation in health tech. So we're a health tech startup. So I'll give a little background on what Helix does and then dive into lessons learned about three different aspects of our business, and we'll get into the details there. So kind of backing up a little bit and thinking about like why are we talking about genomics? It's recognized that there are many contributors to an individual's health, including behavioral and environmental and social factors, and really genetic factors are also a known major contributor, but having access to this data is very limited in today's US healthcare system. So despite a wealth of research, genomics hasn't quite made it into the standard of care yet. And this leaves physicians and patients with a missing critical link that could aid in their decision-making. So patient care journeys are often kind of a bumpy ride or feel broken altogether without that information. So Helix, what we do is we partner with major health systems across the United States to offer an innovative new approach to integrating genomics into patient care. So this kind of program is often described as a key component to a health system's precision medicine strategy. And at Helix, our innovative sequence once, query often, or a SOCO approach, as we call it, this allows us to digitally reuse genetic data for many kinds of tests over a patient's lifetime. Often starting with a broadly recommended set of tests that the CDC, the Center for Disease Control, has designated as Tier 1 for having strong evidence and notable potential to improve public health. So additional diagnostic panels for early detection, diagnosis, and management of things like hereditary cancer, cardiovascular, and other conditions are other kinds of tests that might be performed, as well as pharmacogenomics, which is basically, it allows us to understand drug efficacy and risk of side effects based on an individual's unique genetic profile in order to determine kind of optimal prescriptions for them. Okay, so now let's get into some of the data. Data is really at the core of the Helix business, in the nucleus, if you will. Broadly speaking, there's three parts to the business where data has the most impact. We have operations. This includes the umbrella of enrolling patients into research programs, tracking samples through our lab and other software systems, and tracking different kinds of laboratory measures, in addition to the clinical workflows that return results to patients and providers. Genomic data is prepared for research use along with clinical data and on participants who've consented to research. And on the commercial side, clinical and genomic data are used in life science partnerships for applications like drug discovery and for clinical trials, and to inform broader analysis of health outcomes. So now you might be thinking like, wow, that's a lot of exciting work happening in this very regulated space. How do you navigate all the compliance requirements there? And the answer is you embrace them. So maintaining trust is incredibly important in an industry like healthcare. And if you've lost trust, you've already lost the business. Here's a few of the kind of the rules that we have to follow as an example. Which, in addition to being the right thing to do for patients, arguably also have a positive impact on the overall data management, quality, and security posture that a regulated company might have as compared to maybe a non-regulated company. So under HIPAA, we have to be really intentional about limiting collection, storage, and sharing of PHI or personal health information to what's essential for the business. There's a regulatory component to data quality for services that are in the critical path of delivering a clinical result. So the test is considered a medical device. So this is great news for all of us as patients in the healthcare system, that there's a high bar to quality for those clinical results. In some cases, patients opt to have elective medical procedures performed as an outcome of their genetic test result that might be invasive in nature, including things like prophylactic surgery. And sensitive data like PHI and genomic data really require very rigorous protection. So how do you build a foundation that is secure, compliant, and also nimble? Like, we are a startup after all. I think of this work in three categories. We have table stakes capabilities, removing reliance on manual work, aka automation, and enablement of broader applications. So you first have to decide as an organization. So starting at the bottom here, like, how do you break up the data space? What domains exist in your space? How do you map access levels to least privilege and data minimization principles? You also need to catalog. You need a catalog and a method of understanding what data you actually have. And importantly, this needs to include not only the analytics data layer, but also the data stores owned across teams. And then in this automation bucket, you streamline tasks that operate on data categories and roles to provision access, to assess data quality, to carry out important privacy workflows like DSAR data subject access requests. And then at the top of the pyramid is where significant investment in processes like implementing fine-grained access control and robust de-identification workflows, those can really unlock much more value from the data in a safe way. So in practice, here's an example of how we've put some of these components together at Helix to drive value. We leverage a tool called Sierra to scan and classify data fields across our cloud environment. So the tool identifies data subject context and data classes and maps that to our internal sensitivity levels. We then take this metadata, ingest it into our data catalog. In this case, we're using Data Hub. And then automation is used to generate fine-grained access control policies on our data warehouse to dynamically mask sensitive fields based on access level. The metadata also can be used to enable comprehensive DSAR processes, helping the upstream teams identify data elements that are in scope for carrying out privacy requests. So you're shifting the responsibility to them, but you're giving them tools to make them successful. So now that you have a good handle on the compliance considerations, let's talk about the data quality aspect. So data quality in operational data in particular, and how to bring people along as true partners in that process. And maybe first, before we get into the details of how to pick your contracts and what to implement, I'd like to paint a bit of a picture for you of something that I like to call the data health maturity curve. So it happens to be a healthcare analogy, but imagine it in the context of a data problem that you're facing, and let me know if it resonates. So most of us start paying attention to data quality because we find ourselves in this reactive triage state. It's where, there's a problem that's gotten big enough for a human to notice and cause alarm and become an emergency. So this is basically like you're in the ER, you're kind of like under the line of the maturity curve. And maybe then, you graduate to having detection. So you implement data contracts on the things that might be problems. You turn on some alerting and you pat yourself on the back that, you're no longer being quite so reactive. But then, contracts start failing. They're actually doing their job. That's great. And you focus on categorizing the issues into being able to get to the root cause really effectively. You're understanding the cause of the issue, and that's nice. That's helpful, but it doesn't really provide business value until you are able to identify and apply the appropriate treatment, and maybe even through automation if you're like really advanced. So then you're treating symptoms all over the place. You realize that like what you really want is for the alert volume to be lower in the first place, and how can you prevent bad data and code from wreaking havoc in the system? And of course, this is the space that Gable is working in. An important problem to solve. And then finally, there's an idea of investing in proactive wellness, which maybe you normally try to do on a best basis, but sometimes a much larger investment and commitment is really needed to truly create an effective data model and data enrichment strategy that can keep up with your business. So so how do you navigate this maturity curve? Okay, so to understand where data expectations or contracts should be established, first you want to identify and codify the metrics most important to your business operations. And for Helix, for our company, we really turnaround time. TAT is our North Star operational metric. It's like, did the workflow finish in the time it was expected to? And this is really important for trust with partners and being established as a reliable lab. Okay, then you have your metric, but next you want to understand, what can hurt this KPI. At Helix, we analyzed on-call issues across engineering teams to understand what kinds of problems recur or can be caught earlier in the operational flow. And if there's any level of confusion about the workflow and how that's represented in the software and interacted with by people, a great strategy is to build a shared understanding of the domain events and business workflows through cross-functional sessions that often through what we did is through a framework called event storming, which is often leveraged in domain-driven design cases. So event storming can be used to understand and document what the expected workflows are and what the current ones are, and create cross-functional alignment and artifacts that can be referenced later by the team. So the idea is to bring together software developers and domain experts to learn from each other. At Helix, these sessions spanned different teams, including engineering, product, analytics, solutions, operations people, and it can actually make a lot of sense for a data person to lead this kind of session too. So as you're thinking about data contracts, it can be a good practice to start with a core set of checks that I like to call vital signs. Again, with the healthcare analogies, but bear with me. So think about this. Think about like when you have any kind of interaction with the healthcare system, there's a reason they always start with the same few measurements first, right? Like these can be reliably indicative of other major problems. So just like a provider would take your temperature and your blood pressure before ordering an MRI procedure, you should check to make sure that the data is there in the right shape before running any complicated, expensive kind of validation on it. So to set the thresholds for these kinds of checks, consider questions like which fields are needed to support critical workflows, what happens in the business if the data is unavailable, how does one record relate to others, things like that. And for anything that you would consider a breaking or critical contract, run those upon ingestion or ideally upstream in production. So beyond the vital signs, you want data contracts that address your most critical business logic. So it's worth noting that not all data validation makes sense on write. Source system values may be optional for some use cases, but required for others, and conditional contracts can really be a good way of capturing that nuance. You can draw on workflow expectations that you came up with in your event storming sessions to check for things like valid states under particular conditions and the order of events that are occurring. And you can also make great strides toward your data wellness goals by working with product and software teams to optimize how much of the complexity can be handled in upstream data production and service design. All right, so finally, I want to talk about our research data pipeline a little bit and touch on how Helix has been able to shift a lot of data quality and interoperability efforts upstream in our to our health system partners by leveraging data standards within our industry. So Helix currently partners with 16 health systems. These are like collections of hospitals So the health system will send us EHR data as part of HRN, or the Helix Research Network program. This data is then leveraged in novel scientific research, both by our research team and by researchers at our partner sites. It's used to give insight about health factors and outcomes back to the health systems where these folks are patients, and as part of life science partnerships. So we enlist each partner to take on the data normalization work for their data while supporting insights into the quality metrics back to them with each submission that they make. On the tech side, the EHR records usually come from a system called Epic. In most cases, this is a common software platform that manages medical records and other administrative processes in hospitals. And then we have serverless Spark workflows through AWS Glue that allow us to process these large data sets in a lakehouse architecture. So source data from health records can be incredibly heterogeneous, even within the same EHR system. So there's quite a need to standardize and have a standard model for this. There's this interdisciplinary community called Odyssey, that's how you pronounce that acronym, the Observational Health Data Sciences and Informatics group. They've developed an open source model called an open standard called the OMOP CDM, or Common Data Model. So the OMOP is basically a person-centric relational data model designed with analysis purpose. It has standardized vocabularies for things like medical terms, and it's technology agnostic and provides provenance from the source data. So we're really grateful to have this standard, and we're active participants in the Odyssey community. And then to help health system partners contribute the cleanest and most usable data that they can, we run a large suite of data quality checks on ingestion and then after enrichment as well. So we follow a data quality framework described here that's also been leveraged with some of the data quality tooling that Odyssey maintains. It's called the CON framework. There's basically key data contract categories that include conformance. So this spans across like values, relationships, and derived value computations. Completeness. So are particular elements present at an expected frequency? And plausibility, like are the values actually believable? So that's been super useful and something that we've been kind of using as we develop our own tests. So here's kind of a fun real world example to bring this to life a bit. So a type of plausibility check that you might be interested in could relate to the relative frequency of a certain kind of record. And at one point with an EHR data set that we received, we saw this surprising summary statistic that it appeared that 30% of our cohort had this diagnosis ID that represents an ICD-9 code that says that they were a driver of a bus injured in a collision with a 2- or 3-wheeled motor vehicle in a non-traffic accident. So this seems unlikely, right? And so ICD is the International Classification of Diseases, and other controlled vocabulary for the win, yay. But in this case, this turned out to be a vocabulary version mapping issue. So there was an ICD-10 code. The next version had the same ID mapped to examination of eyes and vision, which is a much more common occurrence than the previously described one. It's a lot more likely to be the right thing. It turned out the ICD version had been switched over in 2015, and the partner had just switched the time frame and vocabulary mapping in their logic. So we were able to resolve that one, but all kinds of things come up. So so in summary, to bring it all back together, these are the lessons that I want to leave you with. So one is to invest in the right processes and systems to be secure, compliant, and nimble with your data. Maintaining trust really is everything, especially in a regulated space. seek to reach a proactive wellness state with your operational data through deep business process alignment and practical data contracts. And consider getting on board to any relevant data standards bus in your industry to drive interoperability and really not only within your organization, but also between organizations at scale. So that's all I've got. Thanks again for having me. You can find me on LinkedIn or find out more about Helix at helix.com.
Awesome. Thank you so much, Anna. Really enjoyed your conversation, especially with my background. Before I got super into data contracts, I was really into healthcare and whatnot. And maybe to add some color to the audience, why healthcare data is so hard. A lot of the data that's collected is through those EHR records, such as Epic. And as you know, all the doctors hate them. So the very people who have the domain knowledge who are collecting the data do not like using the tool for collection. And I was really impressed with you talking about that con framework. I haven't heard of that before. Is how do you change the behaviors of these upstream people who are collecting data who historically have had a bad relationship with these tools?
Yeah, often the folks that we're working with are the IT departments of the health systems, and they're really like the data champions for their organizations. They're incentivized to make the data useful for leadership at their locations too. So that's part of what we draw in, and then really making it easy for them is the other carrot. So how do we identify exactly what the issues are that we find, and then show them where those are, and in some cases even how to fix them.
Awesome. I'm gonna go check the Q&A real quick, see if there's any other questions here.
Wait. I got you. I got you with this.
Demetrios.
I see that Mark, you can't see your screen right now. So I don't see any specific questions coming through on this talk. I'm just looking right now through the chat, and there's general, not necessarily data questions. There's general kind of health tech questions, we could say. And so I'm not seeing it.
So
I think
I can jump
we
in
got to come up
real
with the
quick.
questions.
So a big part of shift left is the change management component. How do you balance, moving quickly and doing these kind of new innovative approaches to data while being in a highly regulated space such as healthcare?
Yeah, it's a good question. I think you want to be clear about the goals of what you're trying to achieve with the data products that you're building. So staying focused on how you bring value to the users who are trying to use the data is really, I would say, really the key. And then you can prioritize different aspects accordingly. It helps to have a great, great partnerships with the compliance, security, and privacy teams to kind of get any questions answered quickly.
Awesome. And then we have another question in the chat is how to find the bad data. Maybe to add more context for that. Healthcare data is vast. I imagine you're working with massive data sets, and you talk about the heterogeneity. It's almost like being overwhelmed with data and data quality issues. How do you prioritize that and know which bad data to focus on first?
So first you want to again, like first, if you start with the structural kind of things and make sure that the structure of your data, the relationships between things are as expected, the frequencies are as expected. If you've got that all down, then really you want to focus on the content, again, kind of like the content that's relevant to the use cases that are going to drive value, or that you have stakeholders that are interested in. So, we might not be able to fix every issue in this vast EHR record collection that we have, but by looking at, what are the common things that we know should be there? What are the things that are research areas of interest for the groups that we work with? Then we can do more granular kind of more granular looks into that.
Nice. There is another one coming through, which is fascinating to me because it's talking about how a lot of shift left seems to depend on the alignment between data producers and consumers. Is that harder to implement when you depend on source systems you don't own, like EHRs?
In some ways it's harder because you may not have like a direct line of communication to somebody who could solve the problem. But even these operational kind of workflows or cases where you have engineering teams that are producing data and you're consuming that data, the amount of context that has to be like captured and tracked between a large set of people is usually also non-trivial, which is why it's hard. It's why why we're having this conference. So in some ways, when we have at least we have the data structure standard and certain things that quite a lot of expectations defined about what we expect to be true in the data, that goes a long way in being able to know, which data is good, how to handle the things that don't meet the expectations.
Excellent. All right, well, guess what time it is? I gotta wrap this up because we have more speakers on the way.